everybody, welcome to my YouTube channel Health and Fitness. Today I'm going to show you strengthening and stretching exercise for non-operative ACL injury and pre-operative workout for ACL injury. Now what is ACL? ACL stands for Anterior Cruciate Ligament. It is the ligament of knee that is responsible for maintaining the stability of knee joints. Means it prevents from the forward and the backward movement of the knee joint. Now, assuming my finger as a leg and I'm assuming this joint as the knee joint. So what is the role of ACL ligament? We notice that sometimes some people complain of that they are having this movement. If the person is having an ACL injury, he will face from this ligament. There will be no control on his knee joint. There will be the sudden movement of the knee forward and the backward. So this knee ACL is a very important ligament of the knee that is responsible for the stability. And now what are the signs and the symptoms of the ACL injury? How can one judge that I am suffering from the ACL injury? The very first sign is that the person will complain of that he's having a bobbling sensation at the knee while walking. He's having no control. Sometimes when he's walking, he feel like that I will fall. He suddenly lost the balance just because this sudden movement at the knee. This sudden movement is due to the lack of the role of the ACL ligament. Along with that, the person will complain of that he's having a pain and there will be severe pain while walking. There will be pain of the knee. Anything may be responsible, but if he's having a pain while walking, it give us a clear sign that the person will be having the problem of ACL injury. Along with that, there will be the swelling. So how it can be helpful for the pre-operative workout? Pre-operative ACL injury, it can be helpful because we are working on the strengthening as well as we are doing the stretching for all the exercise which are playing all the muscles which are helpful for the movement of the knee joints. So we are working on the quadriceps, we are working on the lower limb muscles. While doing the strengthening of that, we can get rid of the pain as well as we can get rid of swelling, and even we can have the good stability at the knee joint. And now how it can be helpful for the pre-operative workout? For example, if an individual is going for a surgery for next month or whenever he's going for that injury, and before that the person is going for these strengthening exercise, and these exercise will be helpful for the individual for the early rehab after he's going for the surgery. There are very simple and very easy 4 to 5 exercise. You can easily follow these exercises for 15 to 30 days and you can hopefully easily get rid of the pain, swelling, as well as you can maintain the good stability of the joint. Now we are assuming this leg as the fit and fine leg, unaffected leg, and this leg I'm having a ACL tear. So we are going to work on my left leg. The very first exercise which we are going to do involves the combination of both arms and the quadricep muscles. Now the first movement we are going to do is that we are sliding our heel in, slightly out. This is very simple and very easy exercise. Moving in and moving out. Our hands muscle is helping in, out. Now what is the range to which you are going to flex your knee? Is the range where your pain starts. For example, you are having a severe pain here. You can stop the range without that. You can just maintain up to this. Going back. Gradually you will see the improvement. You will be able to increase the slightly increase more in then out. Now the second exercise, it is a very simple exercise in which we are working on the quadricep muscle, which is the main muscle for the functioning of our knee joint. We are contracting our quadricep muscle. In this exercise, what we are going to do is that we are simply pressing our heel, we are simply pressing our knee down. We are moving our toe towards us, just maintaining it for 5 to 6 seconds, then release it. Again we are pressing down and maintaining it for 5 to 6 seconds. Again back. If the person, in a severe case, some people are not able to extend it properly. If you are unable to extend it properly, what one can do, we can roll the towel and place below the knee and press down as much as it is bearable for an individual. You can similarly, for this exercise we will be starting with the 10 repetitions, then 20 repetitions. Gradually we will increasing the repetition as per the improvement of our knee joint. And the next exercise which we are going to do is that we just take the foam and our this knee is at the same, and the first thing which we need to take in mind is that our heel should be in air. Heel should not touch the foam. And in this exercise, which muscles we are going to work is that we are going to work on the calf muscles and the anterior leg muscles. This exercise is a very important exercise which is gonna help you to reduce the swelling. If an individual is doing this exercise for at least 4 to 5 times a day, even more than that, you will definitely get rid of the swelling. Now how we are going to do this exercise is that we are just placing the foam below our leg. We are trying to straighten our knee and moving our palm in, back. This exercise is also known as ankle pump movement. Helps in the drainage. We are just having the movement on our ankle. That's why it's known as the ankle pump exercise. Similarly, we can do 1 or 2 sets of 10 repetitions. And the repetition of this depends even upon the swelling. This is not much painful exercise as the sliding and the second exercise which we are going to press. Person may have the problem in that, but this is the pain. We not have any type of pain while doing this exercise, and this is a very fruitful exercise for the reducing the swelling. And definitely if your swelling is reduced, our pain is immediately reduced. Now the next exercise which we are going to do is that in this our knee, the affected knee is at rest. We are placing the foam below the towel. We are placing the foam below the popliteal fossa, below the knee. And here we are just relaxing this knee. Very simple exercise. In this exercise, what we are gonna do is that we are straightening our knee, moving the feet forward and again back. We are squeezing our quadricep muscle in this exercise. And keep in mind that the pace at which you are going up and you are coming down should be controlled and slow. If you're doing in this way, this is wrong and this will be really painful and you are not doing the doing in the correct way. So moving upward and coming down is equally important. It should be slow and in the controlled motion. Similarly for this also we are going to do 10 repetitions, maintaining it for again coming back. Just try to hold for 2 seconds. Come back. You're relaxing your knee. Again, you're contracting your quadricep muscle. You're maintaining this position and you're coming back. For this also, initially, you can start with the 10 repetitions. Now, the next exercise, in the last exercise, which we are gonna discuss here is that just the elevation of your leg. By straightening, you are not supposed to bend your knee in this exercise. what you're gonna do is that this is our range of the flex. I'm going to, at this position, I'm going on my elbows, and we are elevating our leg in the range at the of this knee. We are bringing our leg at the level of this knee, just holding it, again coming back. We are moving our leg up in the slow, and similarly in the exercise which we discussed earlier, in this exercise also the pace at which we are going up and you're coming down should be controlled and should be slow and in the controlled motion. We are not going to rush, or it can not give us a good results. So for definitely for the good results, what we are gonna say do is that we are just maintaining it 5 to 10 seconds in the very slow and the controlled motion. We are coming back. Again we are going up in the controlled motion and we are coming back. In this exercise we are going to start with 10 repetitions. Slowly we are going for the 20 repetitions, and as for the improvement we are going for the 30 repetitions. And by doing this exercise for 15 to 30 days, it will definitely give you the result. The bobbling of your knee, the sudden movement at your knee, all these of complications which an individual is facing with an ACL injury will be covered up with the strengthening of all the lower extremity muscles, hams, quadriceps, and the lower calf muscles, which are the muscles involving in the knee movement. And hopefully this video is a very helpful video for you. I will be uploading with the new topics, and for this do not forget to subscribe my channel and press the bell icon for the better videos and